Hello! We are a group of Georgia Tech biomedical engineers partnered with the Mayo Clinic. We are Team uDrain because we put the user first.
Imagine you've been diagnosed with breast cancer. Your surgeon recommends a double mastectomy, a traumatic procedure that completely removes all of your breast tissue. As brutal as this may sound, you agree to go ahead with the procedure to give yourself the best chance of overcoming this disease.
After the surgery, you leave the operating room groggy and in pain, and you now have one tube sticking out of each side of your chest. These are surgical drains, devices that remove fluid from the wound to accelerate the healing process. A nurse explains to you how to properly take care of these drains before you are discharged and able to get back home, handing you a 20-page instruction booklet and a strange pink roller. If you do not follow these instructions, you may open yourself up to infection, sepsis, or even death. You must use the pink roller or your hands to squeeze out any clogs you find inside the tubing. But the idea of pulling on tubing that goes inside of you is just awful and uncomfortable. Keeping track of all of this, along with your cancer treatment, is quickly becoming overwhelming.
You are one of 1.5 million people every year that have undergone a mastectomy, a tummy tuck, or a similar procedure that involves placing a surgical drain. 1 in every 10 of these people will not properly take care of their drains and will be facing infections and repeated medical interventions that could increase the recovery time of an already exhausting process from several weeks to over a year.
Currently, one of the most common methods of removing clogs from the drain tubing is by stripping the drain manually using an alcohol swab or some type of similar lubricant. However, patients often find this uncomfortable and sometimes even painful, so they avoid practicing proper drain care altogether. A competitor device that has emerged in response to this is the tube evac, or this little pink roller that attempts to make stripping easier for the patient. However, this still does require some mechanical ability, which can make stripping difficult for older patients. Additionally, it's not able to remove any clogs from the suture site, which means that even after using this pink roller, the drain can still remain clogged. Finally, the Somovac is an active pump that provides constant suction to the surgical drain site to remove serous fluid. However, this is a very costly solution and it's not often used in clinical practice.
Two of us are climbers, and in climbing we use this device called a green. The green is comfortable to hold and takes on more information. We drew inspiration from this for the final iteration of our device, which we see being tested. In the next clip, we attempt to use the tube evac to aid in stripping the drain. While it is able to move some fluid down the drainage tubing, once the device is removed, the exudate still does not travel any further than it is pulled. In addition, the tubing must be aggressively stretched, and care would have to be taken to not pull on the sutures in the patient's skin at the excision site, which is normally located around the black spot you see there on the tubing. In comparison to the tube evac and manual stripping methods, the uDrain makes practicing proper drain care simple. All a patient needs to do is put the tubing in the channel, flip the lid closed, and press a button. Then the device automatically does the rest. Peristaltic motion, created by rollers in the housing, works to move the entire fluid column. The rollers also reverse direction to create a plunging motion that fully and efficiently unclogs the drain. You can see here that the viscous wound exudate is consistently drawn through the tube to the collection bulb. This means no 20-page booklet, no more pulling on the tubing that runs inside of you, and no more stress for you or your loved ones. In addition, our device is able to get rid of clogs in the internal drain tubing, something that no device in the market can do. With the uDrain, patients can spend less time taking care of their drain and more time taking care of themselves.
Our device has shown great progress towards increasing patient compliance by giving them a comfortable, easy-to-use device for their drain care. With this, we hope to decrease overall infection rates and improve patient outcomes. Since there is a relatively low regulatory impact of the uDrain, we are confident that we can get this device to the market in less than a year. However, we need your help to do that, and we are open to any and all opportunities that you may have for us. Please use the QR code below to contact us with any inquiries that you might have. Thank you.